Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to today's show of the Executive Innovation Show podcast. This is your Knowledge Knugget edition, and today we're going to be talking about how is telehealth used in healthcare and what's critical in developing new patient workflows. As one things we've seen a ton of lessons learned during COVID of a lot of practices, a lot of urgent cares, clinics, behavioral health, anything across the board, really having to overnight learn how to develop new patient workflows and train staff and do a ton of different things. And so today's edition, we're going to be covering 10 things to consider when using telehealth and what to think about in your practice workflows and your patient workflows and your provider workflows. So the first thing that you should think about is you're taking a front staff that's used to checking in people, that's used to calling patients and reminding them of their appointments, and you're converting them either a hybrid model or partially into being able to tell patients of all different technical skills and demographics how to connect for a telehealth appointment. It's very critical that that's systematic and that you email the patient instructions or you verbally give them very specific instructions. That will really save your providers a lot of time of the patients having the right information, being on time to their appointments, and not having any technical difficulty. The second thing is the patient user experience has to be simple. It has to be simple for all demographics. It needs to be simple enough that grandma at 75 can connect and a youth at 12 can connect and everybody in between. It needs to be so simple that you don't have to give very detailed instructions, that it's 1, 2, 3 clicks to connect. What you've seen a lot with using free services during COVID is downloading mobile applications don't work for patient demographics. It might work for the business professional that's used to downloading that app maybe for work, but it doesn't work for children and it doesn't work for older demographics. So really keeping that in mind will save you a lot of hassle on the back end and will really help your provider satisfaction. The next one is as offices are opening back up, hospitals opening back up, urgent care is opening back up. You have a patient population that was used to using telehealth, that preferred it, it was convenient, things like that. So now you need to think about the patient preference. As we go post-COVID and we look like what is the new healthcare look like, it is a hybrid model. And so you're going to have some patients that want to come in, they're older, they appreciate that interaction and sitting down with the doctor. You're going to have the busy mom, the professionals that prefer to use telehealth. And so patient preference is going to come top of mind in patient workflows, that if that appointment type is available via telehealth, you need to communicate to the patient and ask them their preference. The next one is, as you're doing this virtual care, as you're doing telehealth, you have to think about insurance, payment, copay, how you're going to do that virtually. If you don't have patient-facing scheduling, if you don't have credit card online, what's your process in taking that over the phone? And so thinking about that through your workflow in your front office and your billing folks. The next one is, if you're in the business of doing after-hours phone calls, if you're in the business of doing weekends or extended nights, utilize telehealth for that. Utilize not taking phone calls and moving that to telehealth to make it billable. You'll really see an increase in patient care, an increase in patients using you versus the retail urgent care on the corner if you offer it, as well as being able to bill for that from that standpoint. As you look at the next one Our number 6 is follow-up appointments. As you look at patients that are now coming back into the office and they're coming in because they require labs or they require a physical exam or they require a reason to come in, make sure that you're still keeping the social distancing and that you're keeping the number of patients in the office of what's critical. So start moving some of your follow-up appointments for those patients that had to come in person to telehealth, and then go back and repeat number 1 to 5 of how that's going to work. Number 7, you're still going to have new patients consults during this time. So how do you do those new patient consults via telehealth? As the introduction, let them meet the provider, get the information, and then determine if they need to come in for some type of testing, keeping them out of the waiting room and keeping them safe. The next one is provider scheduling. A lot of people that are doing great things and best practices during COVID that literally turned it on overnight are really scheduling their providers, especially in like subspecialty medicine, things like that, that maybe they see patients in the office in the morning time. Maybe they do their telehealth consults for a couple hours in the afternoon. Maybe it's on certain days of the week. But the average telehealth consult is 4 to 7 minutes. And so your providers can get a lot more done. So if you stack up for an hour and a half in the morning or the afternoon, then back to back, and then they can see patients, that's the best way to do it versus going to in-person and then telehealth. As you'll run over, you'll be keeping people on telehealth waiting as well as patients in the room waiting. So try to figure out that schedule, block it accordingly, and schedule accordingly from that standpoint. Number 9, provider windshield time. As we look at physicians that get burnout and keeping physicians safe, keeping our clinicians safe, that are going from hospitals to nursing facilities to different offices, that maybe even going into a dialysis center or a cancer center or doing outpatient surgery, whatever it may be. They spend a lot of time in their car going to these different locations. So if possible, and they're going to an assisted living to follow up on a few patients, maybe those can be converted to telehealth, or they're checking on some of their patients that might be in the hospital. Look at all the different avenues. Again, go back to number 2, keeping it simple. The telehealth not only has to be simple for the patient, but it has to be simple for nurses, caregivers, CNAs, things like that, so you can scale it and give that physician the work-life balance, get them out of that windshield time, make them more productive, and get them home faster at night. And then the last one is really the training and the technology. One of the biggest failures of COVID on telehealth, although telehealth went off amazingly during COVID, was nobody had time for training. And so that created even the most simplistic platforms for telehealth, created a lot of issues as you put providers that had never done telehealth before, and some weren't that tech savvy, that they went into dire straits where they had to see patients and they had to learn this tool overnight. There's a lot of contributing factors outside of the technology, like Wi-Fi, like browsers, like having the right phone and downloading devices and apps and things like that you have to go in. So creating a cheat sheet for the providers of here's the 5 things you have to know, or keeping it to a 3-minute training or a 7-minute training, something simple, as these guys are super busy. They don't have time to read things. They're in crisis. They're in crisis personally. They're in crisis for their patients. And so trying to make sure that there's still that training that makes them successful, that makes them not frustrated, and that makes them give a good patient experience, but ultimately gives them a good physician experience. So those are the top 10 things to really consider of how telehealth is being used in healthcare, how developing new patient workflows in telehealth, things to consider, things to really master. And if you rolled out telehealth during COVID and you missed some of these steps, now's a great time to go back and fine tune some of these steps that you might have missed because you were moving 100 miles an hour and in crisis. And as we move to the new normal, which is the hybrid model of seeing patients in person and telehealth, now's a great time to go back and start looking at these steps and which ones you missed, which ones you didn't have time for, and which ones you need to prioritize now. So as always, stay tuned. Get your weekly podcast delivered at your podcast player of choice. As always, subscribe on the video side as well as our audio podcast side. And we will see you next week. Again, this is the Executive Innovation Show, your weekly edition of the Knowledge Nugget.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.